SuperTalk Mississippi mornings on a Friday morning. Dave Hughes with you, and joining us now, we have the State Health Officer with the Mississippi Department of Health, Dr. Dan Edney, joining us. Dr. Edney, great to talk to you. How you doing this morning?
Good morning, Dave. I am doing well. I hope you are.
Oh, yeah, definitely. Everything's going great so far, and that's probably a boastful statement considering the number of things coming at us from all directions, it seems, in the news. And one of them kind of directly related to you this week when President Trump made the announcement that he was fairly convinced that Tylenol was linked to autism when it was taken by pregnant women. Just open mic here. Your thoughts on this whole thing?
Yeah, well, I think what's more important is to look at the FDA statement, notice to physicians, that went out this week. And Dr. McCary, who's the commissioner for the FDA, I think really said it best. And the FDA is doing its job, alerting physicians that there are studies that point to an association between acetaminophen and autism spectrum disorder, which is a whole complicated issue in and of itself. But the notice was very clear to physicians that although there's evidence of an association, there's no evidence of causation, and those are two very different things. It's like saying I'm wearing a blue shirt and I have fever. That my blue shirt is associated with the fever, but that doesn't mean it's the cause of the fever. And the FDA was very clear about that to physicians. And let me read to you, I think, the most pertinent part, which really harmonizes with what the medical specialties are saying. Dr. McCary said, in the spirit of patient safety and prudent medicine, clinicians should consider minimizing the use of acetaminophen during pregnancy for routine, low-grade fevers. This consideration should also be balanced with the fact that acetaminophen is the safest over-the-counter alternative in pregnancy among all analgesics and antipyretics. Antipyretics means a fever reducer, because aspirin and ibuprofen have well-documented adverse impacts on the fetus. So it's more of a notice of caution, which physicians already did. And when you look at the studies that point to a possibility of an association, the studies are all with chronic higher dose use in pregnancy rather than the occasional sporadic use that most women would use. So really what the FDA is saying is that, in another statement, they also said that it is absolutely reasonable for pregnant women to use acetaminophen for certain circumstances in pregnancy and consultation with their physician. And I fully support that. And American College of Obstetricians and Gynecology's statement says that as well, is that acetaminophen is not banned. It's not being shown to be unsafe. It is still the safest option we have. But, Dave, we don't want to use any medications in pregnancy that we don't have to use. And when we do have to use something, we always want to use the lowest dose for the shortest amount of time. That's what the FDA is telling physicians, and I think it's more than reasonable.
Well, and one thing that I think kind of gets lost in the shuffle sometimes, because we hear things and we translate them in our brain sometimes to mean something that they don't necessarily mean. And I'm talking about in the FDA statement, the use of the phrase that it is the safest option available. That doesn't mean it's 100% safe. It means it's safer than anything else, right?
That's right. We can't say that. I mean, there are a lot of things that are necessary for use during pregnancy at times that we can't say are safe, but we're trying to pick the safest alternative available for something that's necessary. So if a pregnant woman is having mild joint discomfort, it's a better option to use a topical analgesic or to use some ice or heat locally than to take something systemically like acetaminophen. But if a woman is running, a temperature of 100 degrees, that's not going to hurt the baby, and she's not acutely ill, to watch that temperature, contact her OB, and work together with that. But if a woman is running 104 fever, that is dangerous for her and the baby. It is much safer to take a few doses of acetaminophen to get that temperature down while her OB is treating the cause of the fever, because fever in pregnancy is very dangerous. There is causation there with fetal loss. There's no doubt about that. Whatever the underlying condition needs to be treated as well. But what's important is that we don't have a cavalier attitude towards any medication in pregnancy.
Well, and I think you just put your finger directly on part of the problem, to me anyway, as I've been watching this discussion unfold. It's a societal thing. Everybody just assumes, oh, Tylenol, it's like taking a sweet tart and popping it in your mouth. We can just take it. It's over the counter. It's safe. It's no problem whatsoever, no matter what the situation. And there isn't really any kind of medication over the counter or prescription that's 100% totally safe in all situations for all people, is there?
That's right. One of my things when I was in private practice for over 30 years, I tell patients any medication can do anything to anybody. So we always want to use medications appropriately and effectively, but medications don't need to be our straight go-to when it's not necessary, and when they are necessary, they need to be treated with respect, because sometimes any medication can cause an adverse reaction to anybody, and certainly with our pregnant moms and their babies, we want to have extra caution. But it's very important. We don't want women who are mothers of children with autism spectrum disorder who took Tylenol during their pregnancy to feel like they were the cause of it. There is no evidence of that. The evidence is really looking at chronic use and higher doses, not the occasional use. And I think just virtually every OB is going to counsel their patient, if you think you need to be taking Tylenol, just do it cautiously, respectfully. Let me know if you're needing to take more than one or two doses, and letting them know on the front end how to use acetaminophen appropriately. And very clearly, they're being cautioned, unless it's prescribed, not to use over-the-counter aspirin and ibuprofen for analgesia and fever. Those are not safe in pregnancy.
Do you think there is a tendency, and it's always existed, but do you think there's more of a tendency, I guess is a better way to put it, of people assuming that they know how to self-medicate and make their own decisions on this kind of stuff without consulting their doctor?
Yeah, well, yes. We in America really are a pill-popping culture, and I say that as an internist. It's much easier to take a pill than to change lifestyle or to, use ice packs or heating packs or, topical agents. But, sometimes those pills aren't our best option. Many times they are the very best option. And so that's where, all pregnant women should be under the thoughtful care of an obstetrician. And as the FDA is saying, the use of acetaminophen in pregnancy is not prohibited. It's not even, this is different from what the president said, but I'm looking at what the FDA said, is that women should not even be discouraged from using acetaminophen in pregnancy, but they should do it in a shared decision-making fashion with their obstetrician gynecologist. And that, I think, is exactly the right advice, and that's coming from the Food and Drug Administration as part of the Trump administration.
And it all comes down to, we're not saying it's horrible, but ask the experts first just to make sure, because all of these kind of decisions are situational and contextual. Everybody is different. Every pregnancy is different, even in the same person sometimes. So you need that expert advice, don't you?
Absolutely, and including things such as vitamins, Dave. I mean, pregnant women should not be taking high-dose vitamins without their OB knowing about it, because there are certain vitamins that can be toxic, to a fetus. So just because something's over the counter does not mean that it's safe in pregnancy, and that shared decision making between the pregnant mom and her OB is extremely important.
Can you stick around through the break?
Sure thing. Because I have a trivia question for you when we come back.
Oh, now I'm in trouble. Thanks. Dr. Dan Edney holding class here on Mornings on SuperTalk Mississippi. We'll see if I pass or flunk right after this. Keep it here. Welcome back. Mornings on SuperTalk Mississippi, and a man who has made me more nervous than I have been since my last calculus final, Dr. Dan Edney, the state health officer, who says he has a pop quiz. You got to put me out of my misery, Doc. What you got?
All right, two questions. One I know that you will get. All right, the first county health department in the state of Mississippi was opened in 1938 in what county?
I don't know that, but I would have to guess Hines.
Dave, it was Pike County.
Really?
Yeah, that was an easy one.
The question.
How did I not know that? I did.
Well,
so we had the first one.
He had the first one. It's one of my favorite public health trivia questions.
Okay, that's cool, and we're even better than I thought we were. And my opinion was pretty high to begin with.
Now, here's one about autism spectrum disorder. Who was the first patient officially diagnosed with the diagnosis of autism? Not the first case of autism, but the first time that it was diagnosed. And what town are they from?
You're killing me, Doc, because I saw this just the other day, and I can't think of it now because it's the calculus final pressure is coming down on me, and it just won't come to my mind.
Donald Triplett of Forest, Mississippi in 1943. How about that? The first case officially diagnosed, case number one of autism was of a Mississippi, at that point, 10-year-old from Forest, Mississippi.
Well, we have obviously a history then studying this and dealing with this. Let me ask you, are we any closer to, while we're having this discussion about Tylenol and everything else, are we any closer to figuring out what causes this and why the instances are going up?
Yeah, well, there's a difference between incidence and prevalence. The prevalence is about the same as best we can tell, but we're learning so much more about a really complicated spectrum. Right now we're calling it a disorder, but when you look at the spectrum all the way from Donald Triplett in 1943, who had kind of classic autism with savant component of music and mathematical skills, all the way to extremely aggressive, very low-functioning folks on the spectrum that, we're not even sure if it's the same disorder or if it's a constellation of disorders. And before 1943, autism existed, but it was lumped in with the schizophrenic diagnoses. And so now we're learning so much more and we're identifying it so much more. We've always had autistic individuals with us way, before 1943 and well before there were ever vaccinations. We just didn't understand it to the degree that we do today, and we are learning so much more. I'm not an expert in autism, but I look to the experts who are studying it, and really they're the ones who are learning the most about it. And the genetic factor is the most powerful factor, and it's not one gene. It appears to be multiple genes impacting the central nervous system. And then what's really at play is what factors influence that genetic tendency. There are diseases where there's genetic predisposition but not disease, and something activates it or something exacerbates it. So that's why we're looking at things like acetaminophen or anything that's showing an association. When we see studies with an association, then we follow that lead down the trail as far as we can, looking for causation. And thus far, we have not found any causative factors for autism spectrum disorder outside of genetics. But I don't disagree with Secretary Kennedy that they exist. I do disagree that vaccinations, we have followed that line down the road since the 1990s as far and hard as we can, and it's just not there. And the consensus is it's not there. Acetaminophen is an open question, and as long as that question is open, we need to pursue it. And as we do identify causation, then we can help protect children better.
Well, do you think part of it is the fact that, and this has been exacerbated, I think, over the past 10, 20 years, as people, we're continuously looking for that one big gotcha answer that solves all the problems with everything, and we're trying to do the same thing with a very complex situation like we have with autism.
That's right, but 50 years ago, we were doing the same thing with many cancers, that today we know the causation of things like, lung cancer, bladder cancer, colon cancer. 50 years ago, we just didn't know as well as we do today. I have no doubt 50 years from now we will know much better. But, I do advise us not to chase down, leads that aren't there, that have already been investigated. Let's invest our resources and time and energies to pursue associations where causation has not been disproven, and make sure that we answer those questions. But autism spectrum disorder is such a complicated entity that it's going to take quite a while.
Dr. Edney,
to unravel a lot of things.
We're out of time, but I appreciate you so much, and thanks for the humiliation.
Thank you.